I'm gonna make sure I have all my equipment, and I'm going to clean off my table. I'm gonna go get a wipe. I'm cleaning off my table. I'm gonna introduce myself to the patient. Hi, my name's Elizabeth. I'll be doing tracheostomy care on you today. Have you had that done before? They say yes. I check their, I make sure it's the right patient, so I verify name, birth date, MRN, and I put oxygen saturation on them. So, okay. So she doesn't have her pillow on, which is good. I'll make sure that her oxygen is on, and then just place it down a little bit lower.
Did it and check suction. It's working.
Okay, so we should be good.
This one is still sterile.
So I'm going to
Put it closer
open this,
and
and then
oxygen 100%.
before doing that, I would clean my hands.
If I have a second person, I will let the person
Okay.
hold the mask in the other.
And then I'm just gonna put this drape over
This is still sterile.
the patient.
Grab your resistance.
Put my saline solution into my basin here. And I'm gonna put on regular gloves.
One more time.
Alright. So I'm gonna take off the inner cannula.
Bring the oxygen back to normal
I'm going counterclockwise.
and put the mask back on.
I'm gonna drop it in here. And then I'm going to take the dressing off.
We'll assess the patient's respiration status. That's what called oxygen.
I'm going to toss that.
Off my throat. Clean my station.
Okay. Clean my hands again. I'm gonna put on my sterile gloves.
Now we're gonna move on to the quick hair. I'm gonna change to the dressing as well. Because it's gonna wipe my station. Let it dry.
And my pinch and scoop. And I'm going to clean the inner cannula. There we go. So I'm going to clean it from all sides, inside, outside.
Turn the oxygen all the way up. Get it close. Yep. I'm gonna open the tip.
Okay. I'm just going to rinse it inside. Okay. I'm going to put it back.
Now I'm gonna remove
Putting it in clockwise.
the inner cannula. Put it in the feeding. And also gonna take out the old dressing.
I'm going to take my
I'm
swabs.
gonna check the discharge on the dressing and check the surrounding
And a
skin
4x4.
on the patient.
So I'm gonna using the gauze. I'm gonna go behind and really make sure to get under there and clean the site with both of them. Okay. Now that the site is all clean, I'm going to dry it. I'm going to dry it on all sides. Checking the patient's oxygen status. She's good. Okay. Now I want to replace the bandage with the pre-cut fenestrated dressing. So, can just move that out of the way. So, pardon my reach. I'm gonna put on either side. Just stick that under there. Okay, how are you doing? Is that okay? Yes. So patient tolerated this dressing change well. If they needed their ties done, I would do that, but it looks like they don't. It's clean. It has enough room where it's tight, but not too tight. I'm checking for skin breakdown in the back, and the skin looks good. If I were to change it though, I would keep this old one on as I'm putting the new one on, and then only when the new one is secure, I would take the old one off. So this patient looks good. I'm gonna clean up my supplies. I'm gonna put their oxygen back on. Put her into low position. And make sure that she has her call light and her personal belongings, that the bed is all the way in the low position. And then I'm going to document if there was any drainage on the dressing, the type of tube that she had, in this case tracheostomy, how she tolerated it, her respiratory status, and all that good stuff. Put my names, an initial, and the date, and clean my hands, and make sure that her oxygen is back to what it was before. Okay, so I'm gonna knock, introduce myself. Hello, my name's Elizabeth. I'm here to do some trach suctioning on you today. I'm gonna make sure I have the right patient. Can you verify your name, date of birth? I have the correct patient. I'm gonna take some vital signs, oxygen being the most important. I'm gonna lift her up. I'm gonna raise the bed, and then I'll lift up her head of the bed. There we go. Okay, to a comfortable height for me. And then I'm gonna pre-oxygenate her, so I'm gonna move her mask close to the stoma and put the oxygen up all the way. I typically would use an ambu bag because she has a tracheostomy. And then I'm going to turn on the suction just to the yellow line, so that's between 80 and 120. Okay, gonna check her oxygen. She's doing good. There we go. So while she's getting oxygenated, I'm gonna clean my hands. And then there you go.
Okay, before I start, it's gonna feel uncomfortable. It's gonna be only 10 seconds in there, okay? I'm just gonna put it in.
Okay, so I'm gonna pinch and scoop.
Check it out.
Then this one.
And check her pulse. Doing okay. If you need a second time,
Okay.
I'm gonna give it a pause for 1 minute.
This is all sterile.
Okay.
So
We're gonna do one more time.
I'm going to check my tubing. And then this is my non-dominant hand, so I'm going to wrap it around my dominant hand.
Just
like that. And then using my non-dominant hand, I'm going to touch the non-sterile surface and attach it. Okay. So I'm going to just put it in here and check. Okay. So that works. Okay. So as I'm doing this, I'm going to go in until I feel resistance. And then I'm going to pull out about 1 centimeter. And then I'm going to do intermittent suctioning while twisting, trying to keep it under 10 seconds. Okay, so then I'm going to let her oxygenate again for about a minute. And then I'm going to rest it in here. I'm going to check her oxygen saturation. And she did desat a little bit, but she's going up there. So the minute passed, her oxygen sats are good and ready to go for another pass. So keeping sterile again. I'm going to keep my hand on this one. Okay. I'm going to just advance it until I feel resistance. And then come back up about 1 centimeter. And then do intermittent suctioning. Okay, about 1 second. And then I could do that one more time if she needs it, but I think we got enough out. So I'm just going to coil this up, take it off, take all my gloves off, and I would throw this away. I'm going to keep it for future use. Okay, I'm going to clean up my supplies. I'm going to make sure she has her oxygen. So I'm going to put her oxygen back on her to her normal rate. And okay, and I'm going to turn my suctioning off. I'm going to lower the bed. And I'm assessing how she tolerated the suctioning, her oxygen stats, respiratory status, if she was hypoxic. And I would do my 4 Ps, personal items. If she needs to use the restroom, I'm going to give her her call light. There you go, she has a call light. And then I would document and clean my hands.